Hi, this is assignment number 1 that is required for the Professional Capacity Building Unit at Edith Cowan University. I'm Jasper Lumarda, student number 103-99577. The nursing profession is a broad profession that has many branches. Although it was once thought that a nurse is just a nurse in a hospital, working and taking care of patients and helping the doctor, but today it can be seen that the nurse has many specialties and subspecialties. In this assignment, I will discuss about the career pathway of a registered nurse going to the nurse specialist or nurse practitioner, my dream role and rationale, the strengths, weaknesses, opportunities, and threats, or the SWOT analysis, the personal development plan, and the 5 supporting literature, as well as my conclusion and the references that I used in this report. This is the diagram of the career pathway from a registered nurse going to the nurse practitioner or nurse specialist. Is taken from the Nursing and Midwifery Office brochure 2013. Sometimes a graduate certificate takes more than a year part-time, and then a graduate diploma takes more than a year full-time or 2 years part-time. When you take a master's program, it's almost 18 months full-time or 2.5 years part-time, and you can get a specialty on couple and family therapy as well. In the University of Sydney, there are online modes of teaching as well as on campus. My sources are also from the Australian College of Mental Health. Mental health nursing is a specialized branch of nursing that provides care for patients with mental health illness or problems, and mental health nurses can be an enrolled nurse or registered nurse, but to be a mental health specialist, one must have a postgraduate degree for mental health, and there is a great need here in Australia for mental health nurses because only 1 out of 16 registered nurse indicated that they are working in a mental health institution, and only 82 full-time equivalent mental health nurses out of the 100,000 population of here in Australia in 2013. In Western Australia, only 92 per 100,000 in population, and ACT having the lowest of all states, only having 65 out of 100,000 population. In remote areas or very remote areas, only 51 mental health nurses out of the 100,000 population. Taken from the Industrial Agreement of 2013, the salary of the mental health nurse specialist having the senior registered nurse level 3 in 2013, their annual salary is 96,566, but as of the 1st of July 2015, they have a 110,723 annual Australian dollars annually. The benefits, aside from the basic and the superannuation, they have on-call or RICO overtime allowances, as well as blood plasma donors leave, removal allowances, and other allowances that are too many to mention. Why I choose mental health nursing to be my specialty? Because I have interest in the field. I have been in a placement in mental health institution in the Philippines, and I find it very challenging, and the role is too complex, and but I find it like fulfilling to work as a mental health nurse. My auntie and cousins are my auntie's a psychiatrist, and my cousins are mental health nurses. And I think I am inspired by the culture and health unit that I had last semester. I discussed about fly in fly out workers and their mental health, and there are so many opportunities that I will discuss in the next slide. This is my SWOT analysis, my strengths, weaknesses, opportunities, and threats. One of my strengths is I'm a registered nurse, and it gives me confidence in whatever I do, fulfilling the duties of a nurse. I also have placement in a mental health hospital. I am excellent in medication calculation because I am also a civil engineer in the Philippines. I have enthusiasm, perseverance. I'm efficient and organized. I have strong focus on patient care. Of course, I am eager to learn and apply what I have learned, and had an experience communicating with APRA for registration. And my weaknesses, because I am out of practice already as an RN for almost 6 years. I'm currently adjusting to new culture, language, and work environment, and I am very impatient when pressured. Opportunities that I see are employment opportunities, trainings and postgraduate courses, technical and medical advancement for the mental health, and working overseas or working in my home country in the future. The threats are employers' preferences because some of them needs years of experiences, and I always prioritize my family, and I do not drive, so it will affect the shifts that I will take in the future, and also relocation. This is my professional development plan. One of my learning goals is to be a registered nurse by the end of June 2017. Of course, the professional practice to finish all units and IELTS by June 2017. And critical thinking and analysis is to know what are the requirements for APRA, or the Australian Health Practitioner Regulation Agency, and the provision coordination to understand and follow the scope of practice set by the Nursing and Midwifery Board of Australia. The collaborative and therapeutic practice is to communicate and submit requirements to APRA for evaluation. I see that there are opportunities for future development to be able to practice my profession confidently, resulting to quality patient care, improved knowledge and skills that will be acquired as a registered nurse, and to help others as well when they want to or just enroll in nursing, and improve on communication skills that will be helpful in patient care. After being a registered nurse, the second goal is to enter into a graduate program after 1 or 2 years, and prepare and apply for a graduate program for mental health as under the professional practice, and to know what are the requirements for a graduate program, and to meet the expectations set by the program in the critical thinking and analysis domain, to understand and exercise the high standard mental health assessments, treatments, and health promotions set by the Western Australia statewide mental health graduate program in the provision and coordination domain. Lastly, work with a healthcare team, keeping the continuity of care through the communication other organizations and health service provider under the collaborative and therapeutic practice. You will find opportunities for future development is to participate in the roaming program set by the Department of Health. I will find also the opportunity to understand and experience mental health institutions' diverse backgrounds and culture here in Australia. I will also be able to learn, formulate, and apply mental health nursing care plans and be able to facilitate the coordination of care. Thirdly, my goal is to be an advanced practice RN for 2 to 4 years, and that is to obtain postgraduate study in mental health nursing and apply nursing skills, gaining competency at a level for advanced practice RN, and then create and utilize a systematic management of time and respond to situations that require patient care with mental health and specialization needs. In the collaborative and therapeutic practice domain, enter and participate in mentoring programs. The opportunities for future development are to meet different nurses, of course, for support, and then learn the current and future health technology and innovation, attend trainings and conferences, and exercise leadership and increase accountability. My fourth goal is to be knowledgeable in current mental health nursing trends and in professional practice, consult and policies and procedures set by authorized government and hospital nursing educators. It will be an opportunity if I can attend the e-mental health strategy programs that's set by the government here in Western Australia. And another thing is to update knowledge using the internet and read various trends in mental health. It will be an opportunity to be exposed to different government strategies to eradicate mental health problems. Under the provision coordination, be involved in the assessment of evidence-based nursing trends for patient care, and an opportunity is to apply the trends on patient care. Collaborative and therapeutic practice is to demonstrate respect and sensitivity to cultural and spiritual identity before the application of current nursing trends. And future opportunities will be to visit rural areas and meet other mental health nurses. The fifth one is to be a nurse practitioner with accreditation by 2025, which will be possible if you obtain a PhD degree and seek credentialing or recognition, and an opportunity to mentor and guide junior nurses. Expertise on mental health disorders and medications, and conducts trainings for professional development, an opportunity to encounter new medications. It also under the provision and coordination to consult other healthcare professionals for patient evaluation and progress of treatments, and an opportunity to update databases with new programs set by hospitals. The last one is to be able to diagnose and plan treatment and involve patients, families, and significant others to ensure informed healthcare decisions, and an opportunity to improve communication skills. These are the 5 supporting literatures that can help me with assignment. Number 1 is Mental Health Nursing in Australia, Resilience as a Means of Sustaining the Specialty. The writers discusses about the different types of resilience like personal, group, and professional that can help to sustain the mental health nursing profession rather. And then the second one is what interventions can improve the mental health nursing practice and environment. The writers discusses about the 3 kinds of interventions that can help improve the practice environment. And the third one is inspiration and leadership in mental health nursing. The writers discussed about how inspirational leadership could be radiated from the nurses to the patients and how it is important. The fourth one is opening the veil on FIFO mental health, which I used from the previous unit, and I think it will be very helpful for me to establish why I really like to be a mental health nurse. The last one is the clinical leadership in mental health nursing, the importance of a calm and confident approach. Um, this is this is really important to be calm and confident because it always radiates and gives signals the nurse that she or he is confident. And I think these literatures are can help me build a case on my assignment. Conclusion: I've discussed the pathway to becoming a nurse practitioner, and I've introduced the importance and benefits of mental health nursing, laid out the SWOT analysis and personal development plan, and I've given supporting journals and literatures. These are my references, and thank you and have a good day.